Hola, hola, everyone. My name is Max Cisneros, the Latinx Program Officer. My pronouns are he, him, his. The Latinx Program Officer for the New Haven Pride Center in New Haven, Connecticut. And I'm so happy that you could join us today for Why We Die. This is a conversation that we are having in Connecticut. But before we begin, I want to take this moment to acknowledge the space on which we are, on which we work, on which we love, and on which we play. The New Haven Pride Center was founded and operates awesome. The New Haven Pride Center was founded and operates on the traditional lands of the Pegan, Massapequa, Eastern Pequot, Scotticoke, Golden Hill, Pawcatucket, Niantic, and Quinnipiac people, all of whom spoke the Algonquin languages. We hope that wherever you are, you take a moment to acknowledge and honor the natives people on lands you occupy and the history of the places that we live in. To find out more about native lands and the lands on which you are now, please visit the website that we are sharing right now, natives-land.ca. All right, so now I'm excited to begin our program, and today is going to be about speaking about the health disparities that exist in the Latinx queer community. To have this conversation, we have three amazingly awesome voices that I know personally, and whom I have had, very close relationships with in terms of being able to just have significant experiences together. The first is Eden, Doctora Eden Almasude. Am I saying this right? Almasude, corrige, por favor.
Almasude, thanks.
Almasude, there you go. Muchísimas gracias. Pronoun she, her, hers. Parte de la Samia Collective y también a resident at Yale. I'll just go through this real quick. Eden Almasude. Okay, I'll ask a few more times. Is an organizer with Samia Collective New Haven and a resident and physician at Yale New Haven Hospital. She is indigenous, Amaziga. Okay, yeah, good to know. Well, which is Amazida, which is the base of her work in both healthcare and community organizing. More recently, she has been part of the Husky for Immigrants Coalition to end the discrimination and exclusion of Connecticut residents on the basis of immigration status. Muchísimas gracias por estar con nosotros. I appreciate you. And next, we have Alison Martinez Carrasco. Am I saying this correctly? Carrasco?
Yes, you did.
Okay. Excellent. From Southwest Community Health Center. Oh, perdón, discúlpame. I was loose. From Hearing Voices, pronouns she, her, ella. Allison is a community organizer and an accomplice to young people's fight for liberation. Allison uses her pronouns, the ella pronouns, and is proud to be part of Hearing Youth Voices team as membership coordinator. She lives for building community from a place of love. She is a learner, observer, and a creative. She is a white immigrant woman born in Ecuador and committed to anti-racism work. She lives in Connecticut for 23 years and started her activism and organizing in 2012 with Connecticut Students for a Dream. When she is not building and sustaining Hearing Youth Voices membership, she is diving into poems, making flower arrangements, and dancing into different dimensions. I love that. Hermoso. All right, moving forward, we have Luis Magaña. Luis Magaña, he, him, his, Southwest Community Health Center, works as the prep navigator at Southwest Community Health Center. He started working at the center as an outreach worker and has been there for 4 years. My goodness. Originally from California, Coachella, I happen to know, but now lives in Bridgeport. His favorite season is fall and doesn't like winter very much, which I can say makes sense for me.
I cannot provide this information, but okay.
Sure. All right. Before we begin, I would like to thank our sponsors who make today's program possible. I want to thank Progreso Latino Fund at the Community Foundation for Greater New Haven and CT Humanities. Okay, so moving forward into the conversation, let's just dive right into it. The Latinx community is the one that's the most infected, the one that's the most in danger of death, and the one that right now is getting less treatment, less vaccinations, and because of that is more at risk. So we're having a conversation in English. We've been seeing these conversations happen in a national stage, but here's an opportunity for us to focus on Connecticut. We have folks from New Haven. We have folks who have lived in Bridgeport, folks who work in Bridgeport, folks that are now in New London. I'm from Fairfield County myself. And for us to be able to have these perspectives and talk, localize this situation, this issue, I think is a very special place for us to be. So moving forward, my first question is this. Many think that Latinx folks are at higher risk for one reason or another. What are the specific reasons that you believe, that you yourself have seen, experiences that you have had, as to why you believe that Latinx folks right now, queer, not queer, Latinx folks in general for this question, are more at risk for not just infection, but also not getting vaccine and at risk of death? Let's start with you, Luis, por favor.
Well, hello everybody. My name is Luis. Why I think, well, not why I think, why Latin people are more at risk of getting infected is because they are in fact essential workers. This means that they are frontline workers. So this means they work in restaurants, they work in grocery stores, they work in helping the public. So anything that has to do from retail to service, anything service related like hotels, restaurants, grocery stores. So these are the populations that are in the forefront of, seeing people every day. And it's not just Hispanics, it's also African Americans. So these are the risks. The more you get exposed to people, I mean, this virus, you have the most risks of getting infected. And I actually brought with me an article from the Detroit News. It was a study done in the Wayne State Medical School. And there was this study where they were asking the same question we're asking today. Why are Black people and Hispanics dying and Latinos, because not all Hispanics are Latinos. Why are they dying at a higher risk? And it's the same, they came up with the same conclusion. It has nothing to do with skin color at all. It actually has to do with the environment in which these people live, which it's also high rates of poverty, unemployment, and other social determinants of health that are often caused by systematic racism. Like, for example, our populations don't usually go to the doctor as much. And I always hear, and I think we all hear this in our work environment. Oh, it's the culture. It's we are not used to seeing this because it's the culture. Yes, in part that is true. Like I can say that for African Americans because we live in a country where historically they've been experimented on with many, many things, from giving them diseases, but at the same time, it's unaffordable. So you cannot expect people to go to the doctor often when they have to meet a $5,000 deductible. So all these little cracks put our people at risk, like Hispanics and African Americans. So that's my answer for now.
A great answer it was. Gracias, Luis. Allison, por favor, and then we'll go to Edith.
Great. Thanks for sharing, y'all. Hey, everyone. Again, it's Alison. And I think for folks watching, I'm going to state the obvious, but I think it's important to note that not all Latinx people look like me. We have Afro-Latinx people, and I primarily work with folks who are Black in New London. And I know what has gotten in the way of going to get vaccinated, going to checkups, has been not having adequate transportation to get to appointments, to get to the slot you have available for your vaccine. We are in Connecticut where we do not have reliable public transportation. Mm-hmm. And we're asking folks to go to the casino, to go to places far from where they live to get vaccinated. I had to go to Bridgeport, y'all. I'm in New London, Western Nahantique, Mohegan land. And also, as an undocumented person myself, I can tell you that even though I do have deferred action for childhood arrivals, which gives me a social security number, I still get those nervous chills when I have to remember my social security and have to share why I don't qualify for Husky at Planned Parenthood. So there are different factors that I think get in the way with why we're not going to appointments, and also don't want to share with our health providers what's happening to our bodies, because I think that there is that gap between who is providing me care and who I am. I know a lot of the folks I have seen have been Anglo-white, and it has been very uncomfortable to be sexualized, to not feel comfortable. And I love questions and I love talking, but I haven't felt comfortable before asking clarifying questions about my own health. That has been my experience, and I have been able to share that with the community here in New London, as well as when I lived in Bridgeport.
Thank you so much, Allison. Eden?
Hi, everyone. So I live and work in New Haven. I work at Yale New Haven Hospital. I'm North African and also Spanish colonized. And so looking kind of within the healthcare system, one of the biggest things that I notice is the level of discrimination that is just systemic within the healthcare industry. So this is fundamentally a for-profit institution. So working at Yale New Haven Hospital kind of lives and exists on the base of exploitation of the people of New Haven and surrounding areas. And so it's kind of seen within healthcare the level of discrimination that we're not aware of. So even being in medical school, there are ways in which we are sort of trained to discriminate against people who are undocumented, for example, or who are assumed to be undocumented on the basis of other sort of factors. And so one of the ways that that shows up is in a lack of awareness of the structural barriers that affect people of differing migration status. So, for example, if you're trying to refer someone to outpatient care, if you're trying to refer them to a rehab center, etc., oftentimes people are going to be rejected on the basis of their insurance or migration status, or on the basis of language. So that sort of lack of consciousness of what does it actually mean for someone to go into this sort of setting. If someone is primarily Spanish speaking or another language, what does it actually mean to be in an inpatient psychiatry unit, where maybe an interpreter is going to be called for 15 minutes a day? So is this a therapeutic setting at that point? If someone is unable to communicate with anyone around them, they're only allowed to sort of use phones between certain hours, and no one's actually able to speak to them in their language. And that has a huge impact, right, on their quality of healthcare that they're able to access. So it's just kind of one of the many areas of structural barriers that people face when trying to access healthcare within the system. So sort of even beyond that, before people even get to the hospital, there's this layer of sort of structural discrimination that people experience because of the fear of accessing healthcare on the basis of cost, or because of the public charge rule that makes people oftentimes afraid to come to the hospital or to even seek public benefits that they may even have access to because of the fear, the concern that this may impact their legal status in the future. And so even when people might have the ability to seek care in different ways, I very frequently see people who are not doing so on the basis of these very legitimate fears and a lack of information about the both legal and medical sort of rights that people have to access care, to the right to an interpreter, etc. And so because of that, very often I see people presenting to the emergency room at sort of very advanced stages of their healthcare concerns, because maybe this has been going on for days, weeks, even months before coming, and they're only coming then to the emergency room. So then it has a greater impact on them, on their families, and even a greater cost to the healthcare system as a whole, because it would have been treated through preventative care and regular appointments, and that ultimately isn't the case because of discrimination in the healthcare side of things.
Thank you so much for your answer. There's so much you cover there, and you give me five questions right there in that one statement. But Allison, there's something that you mentioned earlier that I feel like to localize the conversation a little bit more, because you're so right when you talk about the distance, the traveling, the lack of transportation, because that affects a lot of the way that we navigate in this state. Waterbury is somewhere that isn't necessarily very accessible to a lot of us that live in Fairfield County and work out here. You're out there in New London, and you used to live in further around this area, in Fairfield County. So my question is this: although you didn't necessarily know what it was like, where you live, the populated area that you lived during the pandemic, where you are now, after living, where you lived, now where you are in New London, folks in more remote parts of the state been able to cope or not cope with the shifting environments and the social isolation in where you are now compared to how it could be, say, in Bridgeport or in Stamford or in New Haven?
Thank you for that question. I want to be transparent that I'm able to drive. I have a car, I have a license, and that has been so helpful. And not everyone has access to that, especially when you're undocumented. There's still that fear of police pulling us over. And I think about that, and I'm also holding in my heart the young people who, because I've been in school for so long in my undergraduate career, I can definitely relate to what I would say loosely benefits we have had access to because going to a public school in Connecticut, such as it was so helpful for me when I was in Bridgeport and I had a public transportation pass to get to different parts of Connecticut because my tuition was paying for it, so it was included. And I remember being in New London right when the pandemic started, a few months afterwards, let me correct myself, and meeting with young people in New London and how uncomfortable it was for us to have to do our coursework from home, to manage taking care of whoever we are caregivers to in our homes and be at home. A lot shifted. I think isolation really hurt the ways in which we ask for help and ask for support. Us having to go to work didn't stop. I know as someone who has undocumented parents, I am still concerned about how they have to go out to work every single day, Monday to Sunday. I am constantly checking in on them because although police is not supposed to contact ICE if they ever forbid get pulled over, I have that in the back of my mind all the time. Also, I'm thinking about young people I work with who can share those experiences with me where we have a parent who's chronically ill and having to be that interpreter or just support system. Don't get me wrong. My mom is an independent boss woman. Like, she will get it done, but we shouldn't have to do it alone. None of us. And so that's also, I've seen young people have to step up even more. And I don't want that for them anymore. I don't think none of us should go through that. And I wanted to also add a little bit up to what Ethan said around barriers when we go to appointments is also how not everyone has access to an ID. You would think that our, public schools will provide that IDs. So, young people or just folks in general can have something with their name on it. Not every school does that. So I think that also, like, things became harder to do during the pandemic. I would say in New London, because I know in Bridgeport, folks could just like walk over the Social Security building. Like, things, you had New Haven. If you wanted to find work in New York, you take the train down there. I've seen how in Bridgeport we have things in Spanish, like with the pharmacy will tell you what you need to know in Spanish. Not the most accessible, but it's there. I know I love to eat. I love me a good lunch deal. And I remember in Bridgeport loving that $10, you get a whole bunch of Ecuadorian food. And I knew where to go. Like, I knew who I can speak Spanish with and I feel more comfortable. I know that folks who speak Spanish in London, we don't really have that. And so I'm also thinking about how things became harder to access when the pandemic hit. Like if you need to change your name, if you need, I don't know, maybe you want a cuter picture on your ID. Well, that don't have to wait. So just things like that too.
Yeah, you speak truth. There's a lot. There's a lot. You just answered two of the questions that I was going to ask in that one answer, and I appreciate that. No, you're good. You're good. And then we're already nearly halfway through, and there's things I wanted to get to. But there is also something I wanted to, and this is, we could popcorn this. Whoever has an answer here, because I hear this still, and it gets. I thought I had an answer, but I keep hearing different answers to this. But here is, I think, a prime reason why a lot of folks do not seek help. Undocumented folks do not seek help, and please correct the statement. Push back on me if you feel like this isn't, if I'm getting it wrong. Undocumented folks do not seek help because they believe that it will make it harder for them to apply for citizenship if they receive services. I keep hearing this over and over and over again, and so I want to use this opportunity for us to clear up the area here. Anybody can answer at any point. Let me know what you think. Go ahead, Luz.
Can I raise my, well, I can say for, like, I work in a community health center where we don't never ask for any proof of immigration status or insurance, for that matter, for health insurance. Anybody can pay through a sliding scale fee, and it's, you can pay cash or check or whatever you want. So we always have, people are surprised, undocumented people, when they come in, that at the fact that they can access care without, being persecuted or having immigration call on them. They're always scared of, being deported because they have their families here. And a lot of the people, we have to always remember, they don't have nowhere to go. They were like, for example, me, I came here when I was 3. I don't know anything about Mexico other than Spanish. But other than that, I don't know anybody there. I wouldn't be able to survive. Maybe I would, but who knows? And I don't want to try. But anyways, right now with the vaccines, it's the same thing all over again. Everybody, right now the numbers are going down because everybody who could get their vaccine through VAMS, the easy way, I say, already got it. Now the folks that need to get the vaccine are undocumented, people of color, people that are a little hesitant, and all the undocumented people I've talked to, they're always surprised that they can get the vaccine with no questions asked and that they don't need health insurance because they're still terrified that they could, in fact, get deported or they have to pay it out of pocket. And we have to think, we live in a community. If somebody who's undocumented gets sick, you're going to get sick. If they don't get sick, then that benefits you because you probably will not get sick. So it's in the benefit of everybody for us to be taking care of everybody because we could all get sick and we don't want that. We don't want to be wearing masks for another year. Oh, I can't hear you guys. Can you hear me?
Yep, we hear you. Eden or Allison, would you like to add anything?
So I'm done.
Yeah. I want to go back to what you mentioned about the public charge. I will say that I often have to refer back to the language in it because it confuses me. But I do remember when we did have former President Trump announce that public charge will happen against immigrants. So basically, please jump in if anyone wants to support me in this when I'm trying to explain it. But what the public charge is, if you are an immigrant who, for example, is a permanent legal resident and you want to apply for certain benefits, which could be food stamps or Medicare, it could be used against you if for some reason you're trying to get citizenship. I don't know if it applies to folks who are undocumented who are on the pathway of maybe getting their permanent legal residency card. So look, I'm not going to go into the details of what that public charge had, but what I do know is that it caused lots of fear when we had that president that I'm not going to name no more, y'all know who I'm talking about, and it's still existing. I want us to be clear that, like, we need to slow down a little bit. Like, what happened before the now Biden Harris administration is still impacting folks. That trauma is still there. We're talking about how people can't go to or don't feel comfortable going to their doctor's appointments or take action in preventive care for all these reasons, right? We mentioned discrimination and racism. And because of that, I'm thinking about folks who haven't had access to any mental health services since all that trauma we encountered with having to fight ICE to get out of Connecticut. When undocumented folks, queer folks didn't want to go back home once the pandemic hit because they felt more comfortable on campus. When folks who are primarily Black did not want to go back to campus and see police officers there. So I think that public charge is an aspect of how there's a system in place that wants to continue to kill Black and brown bodies. And confuse us with this language, with this bureaucracy, with this language that is I know I have a hard time explaining, but what I do know that is that fear is still in our community, despite how much we fight it when we go out to work, when we go out to take our kids to appointments, when we do all these other things. That's what I have to say about that, y'all.
Yeah, and that's a good point that you brought up, because I didn't really think about that because we've actually had some of these same concerns when it comes to HIV patients, because I work in the HIV department, and some undocumented people receive assistance through the Connecticut Drug Assistance Program. And that is true what you say. And anybody who gets any social services such as food stamps, welfare, or anything, and that's undocumented, and if this person tries to get a green card or file for any kind of legal status, their petitions will be denied. And I know this for a fact because I've been involved in the immigration processes. But yeah, that's a good point that you bring up. A lot of people that are in the process of getting a green card, they will be deterred to get any kind of assistance because of this. And that's very unfortunate, because sometimes these people are frontline workers. Like I said, sometimes they work in restaurants, they work in grocery stores. Because they're undocumented doesn't mean that they're not working. I mean, that's why they come here to work. They don't come here to enjoy the beautiful politics we have in this country, because they're not beautiful. So we come here for work, and that's why I came here. And anyways, but yeah, there's a lot of fear going on, and that's not good. And at the end of the day, this is just politics, as we know, because this previous guy who we will not name, it was just doing it to rile up his base of racists. And that's pretty much it, because we're not taking nobody's job. You want a job? Go to the fields. There's plenty of spots there.
I would just add also that it's not just the money isn't the only reason folks come out here, also because the violence back home is pretty bad.
And for all the countries that get destabilized by this country, and then Americans are like, oh, I wonder why they're leaving. Well, I don't know, because you keep sending guns to all these governments that you love so much. Maybe that's why.
My goodness, I'm sorry about that. But moving forward, I just kind of wanted to also ask, Eden, there was this kind of like scenario where I started hearing this term being used more and more, and I didn't know how to translate it, actually. And I thought to myself, whoa, this is a moment for some language justice here. So earlier I had sent an email where I had the statement in there, and I kind of just want to ask you to help me unpackage it a bit, because I think it gets to why we're seeing some hesitation when it comes to the vaccine. And so the statement is, COVID spreads like a communicable disease, but it kills like a chronic disease. Now, I tried my best to be able to translate it for folks to understand in terms of why the vaccine was vital and important in certain communities, really in any community, but I was specifically talking about undocumented folks who work on the front lines, Lewis mentioned earlier. So can you help me understand a little bit more about what that statement is getting to and how we can better translate it?
Yeah, absolutely. So I think there are several layers here in terms of how COVID-19 affects different communities. and then also the historical layers that are preventing people from seeking care or from receiving the vaccine as well. So I think Luis mentioned earlier the disproportionate exposure of different communities to the virus on the basis of who has the ability to not go to work in person, right? And who are considered essential workers and essentially really in the system sacrificial workers on the basis of this idea that you can throw bodies at a problem and expect it to be fixed without actual respect and dignity for the people who are working those jobs. And so the jobs that other people don't want or are not willing to work, who are ultimately filled by folks who are immigrants. And so the level of exposure is vastly different between different communities on the basis of migration status, race, and class, primarily. And then how it affects people from those different backgrounds is also different. Not because, as is often thought, because certain communities are sort of inherently sicker or more prone to illness, but actually because there are pre-existing conditions on the basis of other structural inequalities. And so what I often see, the way in which I'm most familiar with this is through the Samia Collective. I'm working with undocumented families in the New Haven area, sort of the greater New Haven area, and then in the emergency department at Yale New Haven Hospital. And so in those contexts, I interact with families oftentimes have the entire household, right? Multiple generations, sort of the extended family being sick with COVID. And this is on the basis of these oftentimes pre-existing conditions. So diabetes, hypertension, history of strokes or other sort of things that happened maybe many years previously, but that have not been treated appropriately. People are not receiving regular medical care because of the structural barriers to that. So this is one of the ways in which it affects people like a chronic disease, because it not only impacts people with chronic illnesses, but also the complications of COVID that oftentimes last many months, and we really don't know what that will look like in the future, continue. People are sort of hospitalized or even not, and continue to carry those complications with them sort of moving forward. In terms, just to speak briefly in the terms of vaccines, I think this is a huge issue in terms that really the healthcare industry needs to take on in a very serious way. I've talked with a number of my family members about the COVID vaccine, and none of them have gotten it still. They know I'm a doctor. They know I've gotten it. They know that a ton of people that I know have gotten it. I've been trying to convince them for now months to do that. And this isn't because people are simply sort of uneducated or unaware of things, but because there are very real fears on the basis of how governments and pharmaceutical industries have exploited our people, in particular the global south, to test vaccines, to test other medical treatments that are really not safe on our populations. And so when something sort of comes around, it honestly makes sense that people don't trust government sort of propaganda around sort of whatever is out there. So while the vaccine is safe, I've received it, I am sort of very pro getting our communities vaccinated. It also requires a lot of long-term structural change in order to actually build trust in different communities. So I'll stop there, but that is to say that there's a lot of work to be done, that trust needs to be gained and earned, and not simply expected from different communities.
Thank you so much for that, Eden. You covered a lot there. It's particularly around an issue that I think a lot of us sometimes have difficulty being able to unpackage because of the implications around it. However, I think that this is a conversation we're speaking to different audiences, but I'm going to stick with you for another moment when we're talking. You mentioned the Samia Collective, right? Samia Collective is spearheading along with other organizations, passing a bill, Husky for All, in the Connecticut legislature. One of the audiences that I'm hoping that we'll be able to reach with this video are the folks who interact, whether they're service providers or they happen to be friends or supporters of undocumented folks. What are the ways in which that they can support that community? And one way is be able to advocate not just for, the politicians, no, not politicians, but the policies that are specifically moving through the legislative bodies. So I just wanted to ask you, this bill, I believe it's called SB 956, Husky for All. What are the ways in which this bill can, you've already covered, a few of them, but what are the specific ways that you can think of this bill be able to address certain issues that we've been seeing that have been the disparities that have been opened up by this pandemic?
Absolutely. So this bill, Senate Bill 956, is pushed by the Husky for Immigrants Coalition with a number of organizations who are part of that. I can post some links. I'm not sure sort of the best way to post those. To send a letter and ask your legislators to support this bill. This is currently in the Senate, has sort of been moving along the process this legislative session. And it is to expand Husky access so that it ends the discrimination against people on the basis of immigration status. And so about a third of uninsured people in the state of Connecticut are undocumented. So it accounts for a huge number of the overall uninsured population in the state of Connecticut, and expanding healthcare access to state Medicaid of Husky would be a huge game changer in our state. The children, families who would otherwise qualify for Husky are currently excluded on the basis of immigration status, primarily folks who are undocumented. So one of the key things right now is to push for our legislators to include this in the appropriations budget so that there is funding for doing that. We know that this overall saves money. And so when people are not able to access preventative health care, their underlying health conditions end up progressing, becoming worse overall. They and their families suffer on the basis of that, and then ultimately are forced to seek emergency care, which ends up costing a whole lot more. I've experienced that personally in my family and in the communities where I spend time, as well as at work. So people often present months or even years after they've begun to show symptoms of an underlying issue. And so getting state Medicaid for all and to stop discriminating on that basis is absolutely huge, so that people can, connect with a local community health center and receive ongoing care. So I will send some links. Again, not sure the best way to share those, but it's really important at this point to speak to your legislators, to send letters. There's sort of an automated form to do that more easily. And please get involved in the overall coalition to push this bill forward.
Thank you so much, Eden. Our star care coordinator at the New Haven Pride Center, Juan Carlos Soto, he just shared it on the comment of this video. So you'll be able to find more information there. Muchísimas gracias, Juan Carlos. And also I have a question from Waterbury. We have Juan Fonseca Tapia joining us from Waterbury. You get the whole Connecticut family up in here. I love it. And I'm going to ask you, first, Louis, and then we'll move on forward. From Allison to Eden, and his question is this: all hospitals, medical health care centers have gotten some kind of federal relief in millions. Can you talk about this and how it is that these corporations / organizations have failed to care for our communities and have actually continued to get richer as our communities do not get better? Louis, and then Allison and Eden, if you'd like to.
Yeah, well, some organizations, I will not name names, they're getting all these vaccines from the government, right? And they're also getting some money, but at the same time, they're charging some administrative costs, which is, I guess, reasonable. But at the same time, I think in the beginning of the pandemic, in the beginning of the vaccinations, what I noticed was that nobody could get a vaccine, but it was mostly like we did it by phases, right? The elderly people go first, great. And when you set this distribution to go by first of people that have access to a computer, that can go online, that have the time to know how to use this, it's always going to be people of color, I mean, white people. So I worked at a vaccination center during COVID, all of this. I even worked at the testing. So it was very obvious what was going on. During testing, it was Black and brown people, like Bridgeport residents coming in. So I saw, okay, yeah, it's the community coming in to get tested because, most jobs were requiring testing. So we had it for free. It was working wonderful. So when it was time for vaccinations, this our testing center became a vaccination center. So then it was so weird. I was like, whoa, what happened? All the people that were coming in to get vaccinated were white people, and they were not from Bridgeport. And we're not white hating. We're just noticing that, hey, what's going on? Like the community's not coming in to get the vaccine. It's people from Fairfield. How do I know it's people from Fairfield? Because I was in the screens. I was registering people from Greenwich, people from Waterbury, people from like all over the state. They were not from Bridgeport. And it was people in Mercedes driving down in the hood, people in Beamers. And I'm like, whoa, whoa, whoa. This is definitely not the community coming to get the vaccines. It's people from Fairfield, from all these little rich towns, which is fine. However, the people that we want to serve are the ones that most affected. The people that are mostly dying are people of color. It's not people that are working from home, because you're working from home, you're quote unquote safe. The people that have, frontline people that have to see people every day are not getting it, and they're scared because ABC, immigration, they don't have insurance, they hear different things. So I thought it was not cool. And I'm pretty sure we all notice that now that Hispanics and African Americans are not getting the vaccine. But what was the question again? Did I?
It was no, you covered it. Yeah, it was
Oh,
mostly
how are
why
they
is it more
profiting? Well,
yeah.
business as usual. I mean, it's America. They use us as pretty much guinea pigs whenever there's money rolling in. But and you are going, and I noticed this here in Bridgeport. Not if you look at other organizations, look at people offering the vaccine. Everybody, I think they got all the people on VAMs, right? Everybody that can access the computer, they did it. Now the struggle is getting people, Hispanics and African Americans that don't have as easy of an access to a computer, the digital divide that we hear so often now. And I don't see a lot of organizations doing outreach and going to the community and asking people where they can come get vaccinated. I know Southwest is doing it because I work here and I'm doing it, and I leave flyers everywhere. And actually, I hate the bus people here because I left some flyers on the bus stop and they were saying I had to remove them because we had to pay. Like, come on. But anyways, yeah, like not a lot of people are doing outreach, and I think they just got comfortable with the little numbers they got from the VAMS rush, and that's not cool because the people that need the vaccine are not getting it. And sometimes they don't even know where to get it. So Juan is right, because yes, there's people profiting, they're making big bucks, and they're not getting the people that need it the most.
Thank you, Liz. I appreciate you. Allison, would you like to add anything, or otherwise, we got about 15 minutes, a little less.
Yeah, I think I definitely like what Luis said around talking to the community. Simple as going back to what our ancestors did, right? Talking to each other, passing information. So I love community organizing. That's what we do. And I think that it's important to not underestimate the power of building relationships with each other, to build that trust, because I know in my experience in New London, folks are still very hesitant to get the vaccine because of what was said earlier in our discussion with the ways that our bodies have been used as guinea pigs to test out vaccines. Folks are afraid of the health impacts they'll have, even if they're temporary. I think there's mistrust. And so I think that it's up to us to figure out ways to build that trust. And I think I definitely want to shout out Samia and Hartford Mutual Aid and Hartford Deportation Defense, because I think they've done a really good job bringing immigrant communities together to let them know of their rights and what's accessible, and like doing the jobs as organizers, right? We're doing jobs that government officials, elected officials, ooh, I'm gonna get in trouble for saying this, but y'all need to do better. That's all I'm gonna say.
Do better.
I hear your tone. I hear the tone. There's more being said there, and I love it. But you know what? It's okay, Eden. I want to get to our last questions, if it's all right. I don't want to, engage in erasure here. But there is a topic I want to cover, and it is something that I'm feeling like it's a space for us to be able to do this, because it is coming from a queer, like a LGBTQ organization. And so I wanted to focus on this. There are over 20 cities in the state of Connecticut that declared racism a public health crisis. And there are organizations that are pushing this as well. So when we're thinking about this, then I think it's an opportunity for us to ask ourselves, okay, so how is Sanctuary City part of that process? How is that? Earlier, folks had mentioned how, despite us no longer being, under the reign of the one whose name we shall not say, however, we're still dealing with a lot of the disparities, a lot of the unhealthy living that is going on in this community that's not necessarily of their own doing. They have to survive. And one of those avenues is sex work. I feel like there's not enough conversations going around talking about how sex work has changed under COVID, and how is that navigating even further when we're talking about the LGBTQ plus community. And then you just put that marginalization into even a further space when we're talking about undocumented LGBTQ plus folks who are engaging in sex work. So my question is this, and this we can popcorn around. Basically, where are the places that we should focus in order to understand how we can help and support sex workers who are engaging in this work, and also understand what are the organizations that we need to support, or understand what they are doing so we can support their operations in making the sex work more healthy, or make it not so dangerous in these times. So first I'm going to ask Allison, si puedes, and then Eden, and then Louis.
Okay.
Thank you. I think it's fair to acknowledge that because I am not a sex worker, I am uncomfortable answering on behalf of any sex worker, but I know that I can take accountability for what, as a community organizer, I could do better. I don't know the rights of folks who are in sex work. I know the rights of folks who are in certain lines of work, your basic worker rights. And I think that it's important to understand what rights sex workers have and don't, and what could we be advocating for to be more inclusive, to make information and resources more accessible. I wish I could remember the name of a foundation. It might not even be a foundation. It might just be something like a mutual aid. I was on social media. I found a grant that they are willing to give to nonprofits that work with any sex workers. And it was very specific, and it was for sex workers. And I thought that was amazing. I think that that's important. I think that the discussion of how queer folks, LGBTQ folks have to do sex work because of the discrimination they face in the workforce, I think I could definitely engage more in and talk more about and learn more about. So I appreciate the question as a self-accountability piece for me. And I think that, I think it just, what comes up for me is safety, right? Like the conversation around what are we doing to support sex workers in feeling safe, if they do make it to that appointment in the clinic, if they do make it to that community meeting and such, is what I have to say to your question, Max.
Thank you so much, Allison. I appreciate you. I believe I said Eden and then Louis.
Yes. So I think you just posted in the chat the link to SWAN's Facebook page. So this is a Sex Workers Allies Network. I think one of the big principles espoused by SWAN, as well as by other organizations who are supporting sex workers around New Haven and the state of Connecticut as a whole, is this basic principle of harm reduction. And so there's a lot of discrimination that is systemic against folks who are doing sex work. And it's important to be non-judgmental of that and to just realize the fact that people are doing what they need to do. Folks who are doing all kinds of jobs, who are classified as essential workers, are doing what they have to do to take care of themselves, to take care of their families, and to get by, to just survive in all kinds of different contexts. And we really can't judge that, just fundamentally, it doesn't help anyone, doesn't work. Let's just help people be safer doing whatever they're doing, right? And given that people are going to be exposed, we are in a global pandemic. People are doing difficult things in order to survive now and before. There are constant inequities that people are facing and trying to navigate, and are incredibly skilled at navigating as well, right? People who are living in all kinds of different conditions are resilient and powerful and have networks and build community in order to get by and support each other and continue sort of growing and moving forward. And we have to have respect for that, as well as help support folks who are dealing with these situations and changing the structural barriers that are creating the situations to begin with. So we have to think more broadly, I think, about capitalism as a whole, about discrimination on the basis of different kinds of work that people are doing. And overall, just think broadly about how are we being inclusive? How are we interacting with the people in our communities?
Thank you so much for that answer. I appreciate you, Eden. Louis?
So, can you repeat the question for me real quick?
Yeah, I was just I was asking whether there were ways in which, you're in Southwest Community Health Center in Bridgeport, right? So if there are ways in which we could support sex work, even though we may not necessarily, know about the dangers, but I'd like it to be more of a conversation. And how can those of us that aren't necessarily part of organizations or engaging in sex work can support those that are?
Well, I think when it comes to sex work and anything related to sex work, anybody who works in a medical field should be, of course, neutral, no matter how you feel about their profession, because I know everybody has their opinions, but at the end of the day, these people are trying to get care just like anybody else. And in fact, based on my personal experience, I feel like sex workers get checkups more often than the general population for the nature of their job. And sometimes people that are not doing sex work are more at risk of getting STDs and HIV. And because, sex workers have to use condoms or else they could lose business if they don't. You don't want somebody getting an STD and giving it to somebody, because there goes your business, there goes your money. And a lot of we also have to shift how we see sex work nowadays, because a lot of the people think that it's just, it's people in the corner, it's people in the middle of the night. It's not like that. It's you have a phone, you text your friends to come on over. That's exactly how it works now. Your friend could be a sex worker and you don't even know it. Your daughter could be a sex worker. It's not, we always have this perception, it's just people out there in the middle of the night at 3 a.m. in the corner. No, it's like it could be happening right now. Your son could be having a friend over. I mean, but that's just the nature of it. We don't know. Like, you don't know. Did you ask your parents when to have sex? No, right? So your kids are not going to ask you for permission either. And they might go with a girlfriend, boyfriend, or even a sex worker. So how we can support them is like treat people like humans. I don't think it's that complicated. They're not harming you in any way, shape, or form. So just be a human.
Thank you so much, Louis. That was very grounding. I appreciate that, and healing to hear. So we have just a few more minutes left, and there's so much more that I like. We have a lot of badass voices out here, and there's so much more I want to ask. But I want to give us an opportunity to close this up and basically close it up on Latinx joy. You know, because there's a lot of folks who are in this work right now, and there's a lot of disillusion. There's a lot of sadness. There's a lot of tragedy. There are folks who aren't necessarily even Latinx, but are working with the communities and just feel down about how harsh it is, how harsh we're being treated. And they see it and they notice it. And so I wanted to close it up as a way of kind of like encouraging those folks, you know, those folks that are noticing the work and they're just having a tough day. And if we have any encouraging words for folks who are in this, folks who also know how hard it is. I mean, we heard from, you know, Juan Tapia out in Waterbury, and so I just kind of like wanted to give us a chance to close it up with some Latinx joy. So we're going to be going out. Just give you a couple of minutes to close it up, and then I'll close up the conversation, starting with Alison, por favor.
Okay. Just want to quickly say, Paige, I saw your comment. I really appreciate it. Something to think about, especially since we're still online. Like, how do we make information more accessible for folks who can't read or have dyslexia, etc. But I want to say that when it comes to joy, I think of rest. That's where I'm at in life at this point. So anyone hearing this who's like, I really should be there, I really should do this and that, I know, like, you really probably should. And if your health is declining, you may not ever be able to make it there. So take care of yourself as best as you can, whether that's masturbating, you make that really good food you want to eat, you watch that funny show, I don't care how many times you watched it, do what you got to do, because you're needed, you're valid, and we need to do this together, but I want you to be good, is what I want to say when it comes to joy.
Muchísimas gracias. Thank you.
One of the things I just want to speak to is looking to our heritage. Our history is the future. I think a lot about what it means to be from an Indigenous background. What does it mean to bring honor to my ancestors? In any given scenario, regardless of what we're doing, what kinds of spaces we're inhabiting, what does it mean to bring honor to my grandmother, to all of my ancestors before that? We have resisted colonization for generations on generations. And what does that mean? Right? What does that mean for what I can bring into this space today? And I think that really pushes me to push the boundaries a little bit farther than I otherwise would, to insist on more, to demand more from all of the settings that we're in, that we deserve, as Allison said, to have rest, to thrive, to have joy, to celebrate together, to share a meal. I think those things are more valuable than I can even really put words to. That we need to be dancing in the streets as we protest. We need to be sharing meals. We need to be coming back to our roots in all of these different ways. And everyone has sort of their own threads and their own connections to that. I think together we can weave something really beautiful.
Gracias. Thank you, Eden.
So actually, Eden, you just refreshed me to something me and Max was involved to a couple years ago when you said dancing in the streets. We need to be protesting dancing in the streets. Me and Max, we actually did that a while ago. I don't know if you guys remember, there was this guy, when it was a viral video where it was some lawyer in some place in New York City where he said some racist things to Puerto Ricans. And I thought the same thing you thought, Eden. Instead of doing a violent protest in this guy's apartment, why don't we just tell him, hey, we're going to be who we want to be, whether you like it or not. And guess what? We're going to make a party outside your apartment, and we're going to bring a mariachi and tacos. And that's exactly what we did. Like in 24 hours, we organized everything. And people came, and it was grandmas, like young people, old people, they were coming. And it was a great way to show solidarity, because think about it. If you're gonna show up and be angry and be all negative Nancy and tell this guy that to F himself, you're not gonna get a lot of people. But once we said it was a Latin fiesta, ooh, everybody wanted us to come. And we were thinking this guy like La Cucaracha and all kinds of like things with the mariachi man. It was so funny. And like I was interviewed by Vice and all these news organizations, even in Mexico. It was so much fun. So yeah, like I think, like you said, we have resisted colonization for 500 years. And I think I am the face of colonization as being a light-skinned Hispanic. But I think we need to embrace who we are and definitely not forget where we come from, because we have so much culture, so much good food, so much history, so much languages, not just Spanish, it's a lot. So it's over 30 Aztec languages alone. That's just Mexico. Just think of all the other countries in Latin America. So we have a lot to offer, and we shouldn't forget where we come from, because I think that's pretty unique. In this country, when you're like European, you say, "Oh, I'm Italian." Everybody says, "Ooh, ah, how cool." But if you say I'm Mexican, they're like, "Oh, okay. So you like Taco Bell?" No, like we have to. I think we just have to be proud of who we are. We're not gonna change. If you don't like it, too bad, because you don't pay my bills. So just be who you are. Like it's okay to be Hispanic. It's okay to be Latin. It's okay to be Afro Latino, Afro Latina, Afro Latinx, whatever. So just be who you want to be. Be who you are, actually.
Muchas gracias, Luis. If I could just add to that story, when we were outside of Aaron Schlockberg's house, actually, the lawyer, and if anybody wants to see videos for that, it's hashtag Hablamos Español. There was a gentleman who I spoke to, and he said to me in Spanish, I've been in this country for over 15 years, and this is the first time I ever felt proud of being in this country, because he saw so many black and brown folks and some white folks that were out there to support us that speak Spanish against this racist dude. And it filled my heart and made me feel like, oh, wow, I'm so glad that I'm here. And so that's what we're doing here. And that's why I wanted to talk about Black Joy. So thank you for bringing that back to us. So this is the end of the program, but it is not the end of the conversation. And so I want to appreciate all of you. This is going to be an ongoing situation. This was a moment for us to speak about these things in English. There will be a moment for us to speak about it in other languages and dialects. And for now, I just wanted to appreciate you and thank you and ground this moment and anchor it into future conversations and appreciate our ancestors, as Eden said. Thank you so much, everyone, for joining us. As you know, remember that the center is here for you year-round with dynamic programming like the one we're having here, support services,
Southwest.
case management, and Southwest, and Samia Collective, and hearing youth voices. And you can find out more about all these organizations if you visit newhavenpridecenter.org and our Facebook page. I'm pretty sure we'll be sharing a lot more that's going on among our organizations. I appreciate you coming out and joining us, and we'll see you next time. Hasta luego.